tends to be that when you look at lower socioeconomic status men living in the United States, they tend to have worse tumors. Part of that is racial and ethnic factors and genetic factors, but a lot of it we think is diet, lifestyle, chronic stress, poor access to good nutrition, and factors like this that we don't fully understand, but that definitely do drive this phenomenon whereby men who tend to face chronic poverty and poor living conditions also have worse prostate cancers. And a lot of us think we really need to be focusing the screening efforts on men in those centers. Now, you go around the world and it's a completely different disease everywhere you look for a variety of reasons. There's obviously differences in genetics. You go from the US to Africa to Asia, you get very different genetic predispositions, right? But then you lay onto that diet, lifestyle, environmental factors. So you can look, for example, at these studies of Japanese that moved from Japan to Hawaii to the US, generation after generation. And basically, the closer you get to McDonald's world headquarters in the center of the US, the more you look like an American, no matter what the color of your skin is. And it doesn't go away completely. So there are some genetic factors, for example, among Asians that tend to be protective, but the more like an American you live, the more like an American your prostate cancer risk is going to be when it comes to diet and exercise and other factors like that. We have a paper coming out very soon in BJUI comparing men in Japan to men in the United States who are getting hormonal therapy as primary treatment for locally advanced or metastatic prostate cancer. And if you match these men by Gleason grade, by PSA, really risk match them as best we possibly can, adjust for age, adjust for comorbidity, men in Japan live 2.5 to 3 times longer than men in the United States. And they seem to have fewer side effects. It's fascinating. And again, how much of this is diet, how much of this is genetics, how much of this is lifestyle, we don't know, which is why the next step will be then building up biobanks and being able to actually collect tissues from different populations and really compare them and see what it is that is making these prostate cancers tick differently in Japan versus Africa versus the United States versus Australia.